William Turner. We helped to plan this event, and we're really delighted to introduce both Dr. Gonzalo Bacigalupe and Dr. Manijeh Daneshpour, who are both board members at Family Process right now, to talk about revisiting politics, relational thinking, and an evolving world crisis. They bring very different skill sets to this presentation. Gonzalo has been an expert in using the media to help families, particularly during disasters, as well as family and health disparities, and using social technologies to help. He's currently a professor of counseling psychology at University of Massachusetts, as well as at the University of Concepción in Chile. Manijeh is an expert in third wave feminism. She originally comes from Iran, and she's done a lot of studying of Muslim families as individuals, members of family units, and a distinct group. She currently is a professor of marriage and family therapy in the Department of Couple and Family Therapy at Alliant International University in California. So I will let them take over. Thanks.
Good morning, everyone. It's 8 a.m. in California, Saturday morning. So thank you for joining us. I don't know what time it is in other parts of the globe, but I am very excited about this conversation and collaboration with Gonzalo. And before I begin, all the beautiful arts that you see as part of our presentation are done by Gonzalo. So we have a multi-dimensional, multi-talented partner and board member, and so you can enjoy the seeing the arts more than our conversations, the conversations we're going to have today. So what we're going to be doing is that we're going to give you a just kind of bunch of numbers at the beginning, some statistics to put what's happening with this new world crisis, which is COVID, into perspective. Then I'm going to be talking about healthcare workers, because we are one of them, and there are many of them around the globe that have to take care of patients. And then we're going to talk about several different, I did a study, comparative study between what's happening with healthcare workers in Iran versus the United States. So I'm going to give you some pointers about that. And then Gonzalo is going to talk about what's happening in Chile, give you some information. And then I'm going to talk about the ethics of care in a little bit more information about what we need to do, and then Gonzalo will take over and talk about some of the macro perspectives that we want to include, and then we will open, hopefully having a very lively and dynamic conversations. So next slide, please, Gonzalo. So this is out of August 19, is changing on a daily basis. But what you see is that in terms of the cases per million, Iran right now is number one. And then United States is in the middle, and then Chile is a little bit after. But if you think about cases, there are 220 countries that are dealing with the consequences of COVID, more than 200 million cases, more than 4 million people died. US ranks number one in terms of cases, and more than 634,000 deaths. Iran ranks 12th in terms of the number of deaths, 44,000, and is growing. And Chile ranks 24th with 36,000 deaths, and of course it's growing. In terms of really good data, accurate data, we don't have the best accurate data, but this is just give you a perspective about what's happening globally. And what's happening in Iran is that many of you may not know that Iran has been under an economic embargo since 1979, beginning of 80. because of the regime of Iran and the changes, political changes. And so because of that, there have the economic embargo has impacted the medical system very much. And there are politics involved, of course, in all of our lives. And so what has happened is that they are dealing with politics of we're going to come up with our own vaccination and not accepting vaccinations from other countries. Other countries have not offered them much. And so their people are really caught up in the middle of this, this challenge. And I'm going to talk a little bit more about this later when we talk about this comparative study that we did between Iran and Chile. And so healthcare workers, this has been a challenge for us as healthcare workers because we are providing services to people and doctors and nurses that are in the front, they're front runners, and it has been a very dangerous and real issue for them. Part of it for me personally, it has been my daughter is a bone marrow transplanter and works with groups of patients that are highly immunocompromised. And this has impacted her a lot in terms of what she sees in the hospital. And actually, the study that I did with my colleagues comparing what's happening in Iran and happening in the United States, many of her colleagues actually participated across the United States. So when this whole COVID started, it started from China, and we had, they reported that out of 44,000 confirmed cases, about 1,716 of them were healthcare workers, and about 115,000 deaths so far. The head of the World Health Organization said this is an equivalent of a commercial airline crashing with no survivors every day for the past 17 months. I mean, if you want to think about the gravity, the challenge we are facing is that we have lost that many healthcare workers. So what has been happening is that these healthcare workers have been dealing with all kinds of mental health issues. It's not new to any of us what has happened in terms of their worries about catching the disease, making other people sick. They have dealt with depression, insomnia, stress, anxiety. They have been afraid of getting sick themselves, making other people sick, their interpersonal relationships with families, being afraid of infecting colleagues because they work in the COVID ward, and then isolation from their families. In terms of the study that we did, what was happening both in the US and Iran, healthcare workers, doctors, nurses talked about how, especially at the beginning, how much they struggled with these challenges of how are they going to prevent themselves from dying and getting sick, and also coming home to their families. My daughter and her partner didn't see each other for months because both of them are physicians and working in two different hospitals, and they were very afraid that their families will be impacted, and so they didn't see each other for a long period of time. In Iran, many of the doctors and nurses talked about not going home, staying in the hospital or sleeping in the garage. Also, people here, doctors and physicians talked about that kind of isolating themselves because they were so afraid of families suffering and the emotional impact on them. I mean, we have been talking about this from the beginning, the pandemic, but really zeroing in on what's happening with people that are trying to save lives, and their lives are impacted as well. Next slide, please. So one of the challenges that we saw as we interviewed these healthcare workers was this moral crisis that many of us are very much familiar with. Their lived experiences and in seeing people dying. One of the things that these healthcare workers were talking about was making a decision who they're going to save and who they're going to let die, and the fact that other people couldn't come to the hospital. And they had to be the only one in the hospital, and then letting family members know after the person passed away. So they all talked about the moral crisis that they felt as part of this process. Next, please. So it is not new to any of us that the social media played an extensive role in this outbreak that we have been dealing with. The false information, the media coverage, extensive media coverage, people saying that this is a hoax, people are saying that this is a real challenge. What should we do about this? What is COVID? Is it engineered in China or not? How is being transferred? Is Bill Gates is going to be putting chips in our arms and we are going to be slaves to him? And so those are really have impacted all of us, and we are so close to it now that we're not noticing how much it has had an impact because we are in the middle of it. I'm sure long term we're going to be really impacted greatly by these challenges that have been created for us. Next slide, please. So just a little bit about what we found in our study was published in the International Journal of Behavioral Sciences about the impact of COVID on healthcare workers. I talked about it a little bit before. What was interesting between looking at our American sample and Iranian sample, many things they talked about were the same. They were experiencing psychological stress, how they coped, families. One of the things that were very different was the support of public support, because everything is political in Iran. People weren't really relying on the government, but they were relying on each other. Doctors were talking about how people at the beginning of the pandemic, they were actually sewing PPPs for them and bringing them to the hospital. They weren't according to the codes that they needed to. So the Ministry of Health had to actually tell people, do not 300,000 of them. They will go and sew with companies and then bring them to the hospital without even checking with anyone. They said that they weren't up to code. Some of them were making us very sweaty. Some of them are not even enough to protect us. And then they wanted to keep having people's public support. At the same time, it was challenging for them to think about really saying that these are not what we need. The other part of it, people were talking about, people come to the hospital and they, in front of the hospital, they wanted to make fresh juice for them, for the healthcare workers in the hospital, and so they can have more energy. They said the bags of foods that they were coming to the hospital without coordinating with us was very interesting, and they really appreciated public support in terms of how people were thinking that if the government is not going to be doing a good job, we need to take care of our doctors and nurses. And that was very different. Here also, we saw the public support and people clapping and trying to be very helpful to to healthcare workers. But this was very salient in our study in Iran, that they did that because they didn't support the government to be helping them. And now Gonzalo is going to talk a little bit more about Chile and his experiences in Chile.
Yeah, you want me to? Yes, yeah, so I'll speak, and I will follow up with two comments related to Manijeh's thinking about what's been happening in Iran. In Chile, you know, the healthcare workers, there's a large study that was done in conjunction with the School of Public Health, the university here, plus a large conglomerate of workers. And one of the things that in the surveys, they found that 14% of those surveyed had suffered COVID among healthcare workers. And some of the same psychological impact was present, but also one of the things that workers talked a lot about was first how they were not consulted, how they were taken for granted by the government, and in some way, the schism and the distrust on the part of the government. On the one hand, calling them heroes, and on the other, not necessarily providing the resources, not providing at the beginning the physical resources to do the work, and then really not paying attention to the crisis that was happening. Now, the other thing I want to say about the airliner, and I'll comment on this issue of the numbers and how we become numb, is that since the pandemic started, began in February of last year, 2020. If you want to put it in terms of airliners, a Boeing with 200 passengers, since it began as an average until today, we have about 40 of those falling every day. So, and in some way, if only one plane falls in the world, the world stops. Imagine 40 of those falling, and when 40 of those fall, basically we become numb. So in some way, some of this conversation have to do with getting out of that numbness. So comments about Chile, in the last, I've been part of a large network of scientists and experts and people in communication fighting the government strategy. And I call it Chile as a success or a failure, because there's a sensation, the feeling that Chile has done it very well. In fact, Chile and Uruguay are the ones who have vaccinated the most in the world. And one of the failures has been, how do we count things? Manijeh was thinking about, we are number 24th, but the fact is that the undercount, the public report of the number is actually wrong. It's always 25% less. So the government informs the World Health Organization of a number that is not real, even though if you go to the report of the government that are buried in their web pages, you can find the actual number. So we have a very, to evaluate if a country does well or not, I think it has to be done not necessarily making comparisons with other countries, but actually with their capacities, with their own capacity. Chile is one of the highest per capita in Latin America with Panama. They go back and forth in the last decade. We have a long history of public health success, particularly because we set up a whole strategy for almost a century, since 1939, because of disasters. So we also created whole infrastructure in the late 1950s, early 60s to produce our own vaccines. Chile's been a leader in the World Health Organization. So we have had a long history of good public health with, longevities, even higher than the United States and things of that sort. So, but the last 40 years, what had prevailed is this neoliberal ideology, and which I think has become clear that it's not responsive to the sort of crisis that a virus like this puts us in, and had to do with several things. One is the idea, and this is not just in Chile, and this is why it's a good example for what might happen, also what happens a lot in the United States, is that we tend to think of facing this with one solution, one bullet. And at the beginning, and we saw that in the United States too, with Trump, it was the idea of having respirators in intensive units and expanding our intensive units. And then in the last 10 months, it's been about the vaccine. And in both cases, both of course are helpful. One in terms of maybe preventing more death at the ICU, and the other one, is to hopefully prevent death and the gravity of the illness for those who get the virus through the vaccine. Also, in Chile, as it happens in other countries, a lot of the policies have been tailored around large investors. I'm one of those who the pattern of how disasters lead to the larger sense of inequity is clear. And, in a way, the government, at least here, have been very much interested in crisis communication and not necessarily in risk communication. And that means, sort of like trying to say that things are okay, they will be okay, so that you can stir up investors, and particularly the kind of Wall Street kind of investors. Clearly, and Manijeh is going to be talking about, for many of us, we think that what has not prevailed is an ethics of care, is really trying to what Australia, New Zealand, and South Korea and other countries have done, which is to really pay attention to how do we prevent the death of people. And to prevent the death of people, you really need to point to zero COVID. So Chile also have had a large mortality where, as we saw in the graph before, it has been actually consistent throughout the pandemic in the last 17, 18 months. And I mentioned before the numbers numbing dilemma. And in fact, the painting that I have here tries to graph the death. This is a painting I did on trying to write the numbers of people who are dying. And it was too painful. When I arrived to the number 4,000, I couldn't continue. So that's where the painting ended. So it intends to graph the numbers on the territory. And that in some way, this painting, which is called The Pandemic, is an ocean of data that in some way hides the stories. And for us as clinicians, this is really something that we're going to have to be facing in the long term, with families that have lost parents, have lost grandparents, and in that sense, the figures on the newspapers do not reflect the devastation for families and communities. So the other comment I just want to make is that the virus, in general, the story of the virus in Chile, but also elsewhere, has been too centered on the biology of the virus, on the medical piece, but little on how the social, the historical, political context defines how the pandemic, the curse of the pandemic. And I think that that's something for us as system thinkers, relational thinkers, is something I think that we obviously understand very well. Okay, so I think that that's for that. Manijeh, do you want to?
Yeah, sure. So following up what Gonzalo was talking about in terms of the numbers and in what's happening globally when it comes to COVID, we decided to stay with COVID, even though there are just so many things happening in terms of marginalized people, different countries, resources, because that is something that is the center of everything we are talking about these days globally. So now we are talking about going macro, thinking about vaccinations, what countries are doing in terms of vaccinating people. But then we see the same level of marginalizations that we see with everything else, with the healthcare system, in other communities, we are seeing with COVID vaccination. So 80% of COVID vaccination have been administered in higher to upper middle class nations. For example, UK has vaccinated about 65% of its population. Filipinos, the rate is about 7%. US is thinking now, contemplating the booster shots and actually thinking about vaccinating teenagers. But then in Nigeria, even healthcare workers have not been vaccinated. We have Israel offering booster doses to people over 60s right now. Palestinians' rate of vaccination is about 12%. And these are the people that actually are coming and working in Israel and going back to Palestinian part. So they're not even the people that actually live in Gaza Strip. Then we have Chile and Uruguay that have a highest vaccinations in terms of countries that have people more than 5 million. So the map, we are all over the place. Next slide, please. So the way we have to be thinking about this is that, so what is really happening? World Health Organization has been talking about the goal for vaccination by the end of this year is about 40%, and by mid 2022 they're thinking that hopefully 70% of the world's population have been vaccinated. But right now less than 2% of people in Africa are fully vaccinated. Jarvis Barbosa is an assistant professor of Pan American Health Organization, talks about how this is very morally and ethically complicated, what is happening if they want to think about it from the public health perspective. Next slide, please. Because what is happening is, according to different people, is that who are we trying to protect? So even if we are trying to protect people in America, the professor at Johns Hopkins University, Ruth Karen, talks about that there are new variants coming our way, and they're going to be an unvaccinated population. So she says, so the more of the world that is unvaccinated, the more we are at risk. And she also says it should be the right of everyone in the world in the context of this pandemic to get vaccinated. So there are these moral conversations about what needs to happen. Some people they don't care much about that conversation and saying, I want to be safe and I want my country, my people need to be vaccinated. But she's saying also that it is the best interest, even if we are trying to protect US population, to have as many people being vaccinated globally because of the new variants. Next slide, please.
Yeah. So one of the questions that we are asking now is, you know, and you open a newspaper or report, is this idea of what is the world in a post-pandemic, which in itself is sort of like an oxymoron, because there's no such a thing as a post-pandemic. Probably the environment in which we are, it's probably going to be the environment in which we're going to be. And so I think that, again, and bringing up this notion of, you know, first, you know, that we need to challenge what's the normal. And somehow one of the conversations that happened in a, I wouldn't say that was not dominant, was to rethink what's the kind of societies we want to build. And that in some way, even though the pandemic challenged us in terms of the kind of world that we have constructed, and, you know, of course, in conjunction with issues that relate to institutionalized racism and the climate crisis, etc., which actually we explore in an article, Manijeh, with Marlene, with Ruben, and several others. There's this notion that the virus is just an alert. It's sort of like, you know, it's the appetizer. It's a bad metaphor, but it's sort of like the appetizer of what's coming. One of the things that we have observed is how inequality deepens, and in some way, this is already having consequences all over the world. There's the other piece I think that we've been lacking is connecting the virus and the pandemic with the climate crisis, with the climate emergency that we're living in. This slow disaster, you know, the pandemic is this slow disaster, basically is something that you don't perceive until it's too late. It's similar to what happens with the climate emergency. By the time you actually are conscious of it, it's just a little bit too late to do something. The only thing you can do is to adapt. I do think that for us, in this sense, we're not going to just have to mourn the losses in the sense of the death and the grief, but also I think we're going to have to mourn the loss of, you know, life as we thought it was. even though, and before I think it was, there's a way in which there are challenges and we're going to overcome. And I think that this is going to be much more, and this is something for discussion, it's going to be much more about how do we adapt, because the solutions that we have invented, and one good example is recycling. It's just, they're not going to save us. And I think that that's relevant. The other piece, I think that a big lesson in this returning to normal is that we really need to think about how do we organize around evidence. That somehow it became clear, and it is very clear in the crisis right now in the United States, that organizing the strategy not around evidence can be extremely, extremely dangerous. I also, in this context, and this is, I think, my last slide, is I think that I have gone back to reading Bateson. There's something about what he wrote in the 1960s, even very early 60s, and that it was, I think, misunderstood. And I think that we can clearly understand, it was so visionary, is this idea that control and trying to control the environment is just particularly dangerous and just deepens the problems we have. And I think what might have not been clear in that statement, but is clearly embedded in it, is that it will deepen inequity and it will make it much harder to advance in terms of equity. In terms of the virus per se, and as healthcare providers, I think that prevention is key, and prevention is not just using masks and being in a ventilated place and measuring the air, which is, we need to, but it's really dealing with, the social determinants of health, which in some way, show that are particularly relevant in the context of a country in itself, as well as in relationship to what happens between countries. Collaboration is key. And I think that hopefully we can advance in a form of thinking about One Health. Our health is intrinsically connected to the health of the animals and nature, from forests, from oceans, from sweet water. I mean, everything. I mean, that if that is not healthy, we are going to be destroying ourselves. We need to advance in zero COVID. I'm part of a large, which is one of the most interesting things that happened, I think, and I'm very optimistic about, is the amount of, it's not just the local, it's global. In some way, I think that in the last year and a half, the growth of international networks to deal with the idea of, for instance, zero COVID, it's outstanding. That we are speaking with folks in the UK, in Asia, all over Latin America and the Americas in general, Africa, etc., to really think about how a lot of the things that we're facing are global. They're not necessarily even connected to the usual, political continuum of liberal to conservative, that somehow even those continuums are broken down here. And that to recover, we need to, and this is, and I guess from, even in a structural family therapy, we find this. I mean, we really need to invent a way of restructuring our lives, because otherwise we're gonna be, headed towards destruction. These are the questions we have for today, and this is a small group. And I always channel Janine Roberts around this, because you just put a bunch of questions and then we can address them from anywhere we want. And I think that the question we have for reflection are, what have you learned about your professional role in this pandemic crisis? What ideas and concepts have you adopted to deal with the consequence of the pandemic when relating to patients, students, clients, others? What are the main principles of analytics of care that you have used in your work? And what is your role as a citizen vis-a-vis your professional role, and how are they different? So we are opening it up. And let me stop the sharing here. There we go. All right.
Share your wisdom.
Or your questions or reflections or.
Good morning, everyone.
Morning.
This is Debbie. May I ask, is this open for the whole group or is the panelist going to start?
Everyone.
It's for open for the
Oh.
whole group, and if you can use a camera, that would be fantastic.
Okay. Let me set this up and I will just say, amazing presentation. Thank you. You talked about 2 locations that where I'm located in South Florida, that we really don't get a lot of information or reports on. So I appreciate getting that view. I'm just moving into the room to sit down. Sorry. But this, I think, is a heavy topic on my heart as a therapist. I have had clients who called in, or, through the computer, through the telehealth. There we go. Okay, I'm settled. And, it's heartbreaking. One of my clients' husband had COVID, and then unfortunately, at that moment, he didn't know. So he came home, but it transferred to their mother. And within the matter of the 2 weeks, they were thinking, okay, everyone's going to be fine. They're going to recover. And then the mother passed away. So it has been very, very difficult to hold space for clients and to recognize this pandemic, even when we're thinking, maybe we're on the other side of it, that we still need to be so careful. And we also have to understand what clients are going through in terms of the grieving process. When I think back in school, our grief and loss classes, this is a whole nother moment. This is a whole nother space to be mindful of, to learn, to gain information like what both of you shared today. So thank you. And my question after my reflection is, for therapists in direct services, as we are scaffolding space for our clients, what is your process for reflection or reflective practice and supervision?
As you were talking, I was thinking about healthcare workers that we interviewed and how appreciative they were that we were asking questions and saying, how are you doing? Outside of, everybody has been asking them, of course, family members, public, the governments and all of that, but just kind of to zero in and say, how is this impacting your mental health? What is happening? And many people got very emotional about sharing, how scared they have been for themselves, for their families, seeing their colleagues dying. And so I believe that as mental health professionals, we have been also impacted. We are part of that group ourselves. And then we have to be an emotional container for other people, which makes it really hard because many of us, our families are struggling with the same thing. And then we have to kind of compartmentalize and at the same time be able to hold it both together, because our authenticity is also very important as mental health professionals, and how real we're going to be in the therapy room about how difficult and scary this has been. And so as real as you can be, and that's how I have seen it. I don't know. Gonzalo is going to probably talk about it as well. And the issues related to health disparities and who gets to be helped and who is not, it also going to be very soon part of our conversation. So I'm hoping in supervision, we really prepare our students, our colleagues, our supervisees to hold all of these perspectives together and also think about health disparities and marginalized people and how much more they're suffering. And also what I have been doing is talking about a much larger world perspective, even in the little therapy room, talking about somebody's losing someone or somebody's not getting vaccinated and people are saying, I don't believe in vaccination, as if it's a religion and it's like you have to believe it or not believe it. And no matter how many times we say, this is just a medical situation, and we have to actually think about it in terms of medicine. Another thing that my daughter was talking about, she said, as physicians, we are really struggling that we are learning about this in real time, like everybody else. And so every day, like science is, we are going to be dealing with new information, and people are frustrated that we are not 100 years ahead of them, have experimented with it, understood it, know what to do, know what to say, not changing our minds. I mean, Dr. Fauci has been getting all kinds of criticism because supposedly he changes his minds about different things. And so keeping it very personal, but at the same time, keeping it professional, right? So talking to our clients and validating them and understanding their pain, and then having a macro level understanding of what's happening globally, and also taking the climate change and what's happening in our environments into consideration. So go micro, meso, exo, macro, and good luck.
Couple of
I
comments,
think,
maybe more than a couple.
I think that Marlene, just to let you guys know, I think that Marlene also had a comment to make.
Go ahead.
First and foremost, thank you for such a fantastic presentation, that has sparked a lot of reflection and thought. One of the things that I wanted to comment in response to Coach Debbie's question had to do with ethics of care, and as teachers in the classroom, that it was important, and for me, especially important, to focus on humanity and what students were experiencing versus what I needed to teach them about theory or what have you, because this is something that, as your presentation has shown, has really changed a lot and begs the question of how life is going to be, that we might need to restructure. And it became really, really very important. And one of the things that students commented on in their evaluation of the course was how appreciative they were of taking that time in the beginning to check in and talk to them, because they were experiencing losses in real time, not being with their families, their loved ones, and really, thinking about what is my future going to be? What kind of future am I going to have? Because these are all unknowns. And Manijeh, as you just said, it's happening every day in real time. And so I just wanted to say that, that's the ethics of care, bringing it back to, that humanity perspective that I think is also very critical for us, and that we need to remember, as we are teaching and in those roles that we hold. So again, thank you so much for this really, enlightening and very thoughtful presentation.
Thank you, Marlene. Commenting on the question, in my practice, I basically see couples, and I also see a lot of healthcare professionals. That's how my practice has evolved through the years. And one of the things that happened for me as I listened to physicians, nurses, people that are in the healthcare environment, and was making the connection with the need to actually get involved in organizing, in moving beyond, the stress as just this individual thing or even family thing, to really expand and say, hey, these are structuring conditions. This is not about my psyche, so to speak. And I think that is very relevant. I mean, the amount of people who were taking medical license during this period and just couldn't continue doing this. I mean, we just did a focus group a few weeks ago with some healthcare people in hospital who, especially at the beginning last year, the idea of attending to folks who were going to die alone, and for them to have to then communicate this to their relatives who could not be there, is something that it was quite unique. And in some way, I think that because we didn't know much about the illness, although I have to say I wrote more than a year ago that this was airborne, and some of the measures that were being taken didn't make any sense, like not being able to go to a funeral, for instance. It's the most stupid thing that could have been done, but whatever, public health officials sometimes need to create rules so that we feel comfortable. But so I think that one of the things that has been central is this idea of revalidating the story, and because it's not going to happen in the institutional context. And I think that there's an important role there. The other piece that I found, I stopped seeing kids and adolescents, but I began seeing some adolescents who decided to go back to school, and all the fear about that and how to negotiate that piece. And again, a lot is about figuring out how to make it into a collective effort. I think that for a lot of us, I lost my mother last September, and she didn't die of COVID, but the previous months I couldn't see her, and I could not be with my mother until the day she died, really. I mean, I was lucky to down to her with her the last day, and I didn't have to use the mask because I knew she was gonna die. But I have this sense that the grieving for millions of people is gonna be something that we're gonna have to be dealing with in the long term, and that we need to create that space for that to happen, and that this is very real there. I also want to say that, and in relation to students, I feel that it's never enough. That's my sense during this pandemic, particularly as we were relating so much in a virtual sense. I mean, I've been teaching online for a long time, decades actually, but that this was very unusual because it was all online, and there's something about the difficulty of resolving interpersonal conflict online. They just get magnified. And I don't have an answer. All I want to say, though, is that it intensifies. If you're too responsible, you become more nervous about that, and vice versa. So it's something that we're going to have to observe more, and I love what you were saying, and that in some way, where do we find the space for ourselves? Because in some way, when you're for majority of people who work in healthcare, even those who have private practice, they do have mini exchanges, micro exchanges with other professionals about things that are happening, so that you can process more beyond the supervision hour or the consultation hour. And those spaces are not there. It's like when you go to a conference and the most important part happens in between sessions. Building that up and virtually, it's just very, very, very hard. You have to be very mindful. And I think that it's sort of like the drop of water that falls and falls and falls. And at some point it explodes. You don't know what is happening. And it is because you didn't have that sense of being able to check with someone immediately after when something is happening. And that's, that's something that I think that we're gonna have to listen to ourselves and be more patient about it. Yeah.
I wanted to just jump in and say that Carmen Valdez had to leave our Zoom call, but she wanted to say that she thinks it would be great if Family Process could launch a special issue on global multipliers of family well-being and mental health disparities. And she is happy to talk over ideas with anyone who would like to.
Marianne, please go ahead.
Let me get unmuted here. Fred is also here. He just can't sit in a chair right now, but he's listening and engaging in this conversation. I want to switch topics. I loved your presentation. And one of the pieces I really enjoyed was seeing Gonzalo's artwork as we process these traumas. And, I'm a big believer that the arts have been around for, millennia, because they do help communities process trauma. So visual arts, music, dance, rituals of a variety of natures. And given such a worldwide trauma, I can't believe how many people have died. I look at these numbers and you're right, you get numbed, but occasionally it comes through and you think, oh my God, we need to start thinking about what would be the art's role in helping communities grieve, and what types of rituals can be offered at a community level or even on social media to help us process this in a way that gets us out of our left brain, because I think it's so overwhelming at a rational level. Very few of us can tolerate that. But on a right brain level and with community, I think that is how people get through this. Memories, the Latinx Greater Boston Arts Project. Wonderful. Yeah.
So, yeah, I mean, we're going to have to figure out how to memorize it, because our brains are not going to be able to hold it. And art is one way to actually do that. Yeah.
Art and music, I play the piano at the Cancer Center at our academic hospital, and so many people will come up to me in tears and just say how it's helped them or touched them, and with other musicians as well. So I think as therapists, both for our own resilience, I'm not doing therapy anymore other than through the music, I guess, but it is a way to refuel ourselves, but also to help our clients and patients, I think, is to consider what right brain activities you can integrate into care.
Just want to make a comment about that. If you remember at the beginning of the COVID, I don't know if this is I'm mixing things up, but at least in Iran, every day there were videos of people coming to the hospital and playing music, and then having healthcare workers and doctors dance to it in the middle of taking care of patients. And it was just viral. Every day you will see hundreds of videos of musicians coming to hospitals, and I think happened here as well. So it is a way for us to incorporate music in art, in rituals, like you said, as part of this. The other part of it, as we were doing research to put the introduction part of our papers together, what we saw in terms of what helps people was the idea of caring for others. That going beyond their families and, oh, my mother is sick, oh, I'm worried about my sister, it's going beyond that and saying, what can I do for my community? And so in at least in Iran, in terms of the study we did, we saw that people did better when they weren't so worried about their own immune system and worried about other people. And now what we are seeing is that people that are anti-vaxxers and anti-maskers, and they're saying, it's my body, I want to have control over my body, is that idea of not caring for other people that is very central to what is happening, is that I can make a decision about me and I'm not going to worry about other people. And so if we want to be helping people, is talking and discussing ideas about, if you really care about other people, you're going to feel better, because we literally saw that that people can improve in terms of their mental health if they go beyond their own pathology and pain and what's going on in their families.
Yeah, I wonder what kind of community rituals would bring together some of these anti-vaxxer, anti-masker types with the rest. And early on in the pandemic, you know, at least in Denver, we had a community ritual every night at, I can't remember, I think it was 7 or 8 in the evening. Neighbors would go out on their porches and either sing songs or bang drums or make noise as a way to, you know, celebrate the healthcare workers. But it was also kind of a nice way. You couldn't get close to your neighbor, but you could see them and you could do something with them. And that seemed to work, at least for that initial spring, early summer. And then it fell away as the summer came and people seemed to get a false sense of security.
Yep.
I don't think anything's replaced it, at least in our community, as a community ritual to encourage people. But that's something to consider, I think.
Go ahead, Tom. Hi.
Hi, I just wanted to make a couple of comments. And one is this tension between isolation and community that this pandemic has underscored for all of us. That the cure is isolation and the cure is community. And I'm responding to your comments, Marianne, of the community feeling of everybody hitting pots on the doorstep. The other comment that really came from your talk, Manijeh and Gonzalo, is that this event in our lives is world changing. It's the world is not going to be the same after this. The only thing in my lifetime that's even comparable was perhaps World War II, when afterwards the world had to change significantly, and did. What is left to be seen is which of those two forces is going to prevail. Is it going to be community? Is it going to be reaching out to one another? Is it going to be the internationalism that you're talking about, Gonzalo? I hope so. I think so. Or is it going to be, I'm going to keep what's mine. I'm going to keep my own body. I'm going to not, I'm not going to get a vaccine that would help anybody else. Thank you. I'm an optimist, and I'm going to go for community and continuity of the human experience, because I think although there's something to be said for holding on to what you have, there's also a whole lot to be said for what are we going to do tomorrow? What are we going to do with this world-changing event that we've all lived through and are continuing to live through?
Tom, I think that, I'm generally an optimistic person. I mean, I'm in the sense of like go on, but I'm a bit pessimistic about the hopes for a change because of this, because I think that the proposal is to degrowth, and it's not in the mind of anybody really. I mean, it's only a minority who are thinking the only way out is to degrowth, and to degrowth in equity, which is, is so that means to reduce the privileges of some. And that's the proposal, I think, that, and it's not just for the sake of us as humans, but also for the, the health of the rest of nature. That proposal is just it's really, really hard for people to think about, because I think, and that's and again, in the progressive conservative continuum, what is not questioned is the idea of growth. And you know, this is a crisis of growth. In this case, urbanism, you know, taking over, you know, rounding nature rather than nature being around us is we put it in little parks. So that's, I mean, as a metaphor, it's a metaphor, is real, but it's more than that. But I do think that's the part, and I hope that more people committed to that idea that we cannot just go and find another, quote, green energy, which is not so green, or just get water out of the ocean or whatever. Those ideas are just, they're more of the same. So that's the big challenge, I think. And from what you see around, not only in the countries I know, you see everywhere, is this idea of how we get back to where we were and doing, quote, more. And that makes me a little bit, not a little bit, really worry about. We need less. Bill is so like wants to say something. Go ahead, Bill. We cannot hear you.
Sorry about that. First of all, I just really want to thank you guys for such a tremendous presentation. I really have been stimulated by all of the ideas that you shared, and really it's given me a lot to think about, and ways that I can go out in not only my own personal spheres of influence, but how I might be able to apply this to larger macro systems. And that really is the question or concern that I have this morning. We've talked a lot about how to, I see us as family therapists, as family systems people, as being healers, and about bringing healing to the world in many ways. And we've talked about that in terms of micro, in terms of how we work with families, how we do that at the meso level, in terms of even the profession that we happen to be in. But the real concern I have links to the two previous discussions that both Tom and Gonzalo were addressing. And those have to do with, I think, sort of macro level ideas. You know, we live in a country that has historically and traditionally been very sort of individualistic. You become the best person that you can be, you take care of yourself. And that has been, sadly, a sort of prevailing philosophy, at least among some people, or maybe even a great deal of people. And especially in recent years, in the last administration, where, you know, there was a whole bunch of talk about, you know, sort of taking care of yourself and not caring about anybody else in the world. And I guess I'm just wondering how we as systems thinkers, as healers, can bring some healing at the macro level. How do we intervene in a way that helps us at a larger level to begin thinking much more about being compassionate and caring and helpful to others, looking out for the needs of, you know, of other people? There's a lot of pushback on that in some parts of our world. I live in Tennessee, and it's one of the lowest vaccinated states. And yet I walk around and see most people who are not wearing masks and aren't social distancing. And interestingly, the ones of us who are vaccinated, we continue to wear masks and social distance. I listen to the arguments that the folks make. I mean, this past week, there was it's been on the national news, there was a school board meeting where the physicians and the reasonable people were actually sort of chased out of the building by people who said, I want my rights, I want my freedoms. And this is not from an unsophisticated community. This is from one of the wealthiest communities in Tennessee, the 7th wealthiest county in the United States. I mean, we're talking about people who are educated, who are saying these kinds of things. And so I just worry about how do we bring a sense of healing at a larger level. You know, Marlene and I both have worked in federal government or worked in Washington, D.C. and thought about I know for me, as I did that, I was thinking about ways that we could bring sort of systems, ideas, and principles to the federal government and policy and that sort of thing. But this seems like on a whole nother level, and I find myself fairly frustrated. You probably hear that in my voice, and discouraged by how we bring that kind of sense of healing and well-being. And I just wondered if anybody had any thoughts or ideas or ways that you manage and cope with the sort of more sort of negative responses that we're getting to things that seem to me to be just really, I mean, this is science. This is real stuff. We're having the knowledgeable people tell us one thing, and then other people say, well, I just don't feel that way. I don't think that that's the way it is. And I'm like, well, who are you to even know that or say that? And so I'm just wondering if anybody has ways that they've thought about that, dealing with that, or how you deal with that in your own life in terms of how you come to peace with that kind of conflict that exists in our world.
We talked a lot about that in the APA conference last week, the meetings that I went, particularly with folks in the environmental science world, about how every piece of evidence becomes a way of confirming their lack of understanding of the evidence or internalizing it. And I just want to say one thing. I think that if you do not have an emotional connection with the folks that you're having a conversation, all you're going to do with the evidence is to confirm their beliefs. Right. And that's what I conclude. I used to think more that it was about neither fear, neither, so maybe I'll channel my friend David Trumbull. It's just going to be love. And it's very hard to love those people.
Mm-hmm. I'm going to add something to hopefully to this conversation by saying by going macro and saying progressives have to get louder and less polite. I don't know how to say it differently, but what happens with us, those of us that are, I mean, if you think about governments, conservative versus progressives and globally in different places, I can compare the conservatives of in Iran, mullahs and people, clergies that are extremely conservative, and their rhetorics are exactly the same as what was coming out of White House for 4 years. It's scary how the words are even the same. On the other side, the progressive side, the words are the same as well. We are polite, we are respectful, we are trying to engage in understanding conversations and validating the other side. And so every time we have a progressive government in Iran, these conservatives are just say whatever it takes to destroy them. They don't care about reputations, they don't care about anything. So I think globally, progressives have to get louder. We have to learn to use different strategies in engaging people in these conversations. Being polite and validating and sitting back and saying, how does that make you feel? Is not going to work. So I'm challenging all of us to be more gutsy, even in our conversations with family members, even in our, so practice in families and say, so what, somebody gets offended on this side, because progressives are offending us left and right. I mean, conservatives are offending us left. They don't care. One of the appeals that of Trump was the idea that he could say, when people who adored him, you would ask them, so what is it about him that you really appreciate? They say, he just says what's on his mind, right? That was something that people say, he just says it. The way he feels. And for us as progressives, we think about all aspects of our conversations before we talk about it. So for one, I'm optimistic and think that we can change things if we become the agent of social change, one person at a time, one relationship at a time, but also taking it to the national level wherever we can. Go ahead, Carmen.
Carmen.
Good morning, everyone, or at least it's
morning.
morning here in Portland, Oregon. And so many wonderful faces that I recognize and some I don't. I was just thinking a similar thing, Manijeh, about needing a stronger voice and feeling some of this for years, feeling the frustration about, you know, how do you deal with people. It's sort of an inequality when one side is willing to be respectful of the other and the other side isn't. But I think it's also thinking about it as a like narrative of the dominant discourse. And I don't know about globally, because obviously there's many cultures that have a more collectivist kind of ideology, probably including Iran. But here in the United States, we have such a discourse around individualism. And some people, I've been reading recently about the connections between narrative therapy and brain physiology and the need for emotion, emotional salience in order to make a new sort of like cognitive thought stick into being an actual narrative or story that people carry forward. So I don't know what that means exactly in terms of our role as family therapists, but it definitely seems like the need to have to activate voices that can really create a resonant narrative about caring for others and being part of a collective, and even tying that back, that's my question about individual healing and such like that, and depression as being a sign of disconnection from others and that sort of thing. I mean, I do think that's our job, is to change that dominant narrative, and that the Western worlds have been imposing that dominant narrative on other societies and not learning and listening from the many groups and people who do have narratives about that. And I think, you know, back when field of psychology, modern psychology and psychiatry were being developed, I think there was value in helping people sort of free themselves individually from some of the oppression of society. But I think we've swung way, way too far on the other side. So I wish I had more answers.
So, Carmen?
What?
Yeah, I was thinking about, you know, I'm a public health person, and, you know, probably one of the largest successes is the elimination of tobacco smoking inside places in the United States. And there's probably the most similarity about third, you know, someone smoking and you getting it, even though you don't smoke. It's the most similar to this virus. And somehow I do think that there's a whole lobby about not actually making that connection for obvious reasons, because it basically means to question where we work, the workplaces at work, because most offices do not have cross ventilation. There's setups for contagion, and it is as if it is as if smoking inside places were right. And I think that is the connection we need to make. This is not about hygiene in the traditional sense. And I think that we're still in the hygiene thing, you know, the gel, the washing hands and all that, which is good. It's good for you to wash your hands once in a while, but clearly that's not the way it goes. And I think that, and it is not even about HEPA filters. It's not about good HEPA. It's about cross ventilation. But we live in places. This is the same. It happens in the 1920s with this, with the last time we had a pandemic of this sort in the 20s. That this is when we learn. I mean, and it's interesting, most of the third world learned that you need to open windows. I never understood why Chile, they don't keep hitting on, because always they open the windows. And now I understand, because we had another big pandemic in 1958, 63 years ago, where, you know, it was dealt. But in most developed countries, very industrialized, particularly in the States, we closed spaces, and it had to do with another feature, had to do with the fear of the outside. So we are in, you know, these large buildings with large windows that do not open and do not offer cross ventilation. So, you know, I think that it's not going to be about changing people's consciousness. It's going to be about structuring the places in the same way we have structured prohibition of smoking in. Remember, when we were kids, all of us here, doctors will smoke in a hospital, and people will smoke in the waiting room. So that's the kind of change we need. And you know, how do we create technology so that there's cross ventilation in every office in the United States? Hard, isn't it? Really hard, because it really redesign everything. And so, because a sign of progress, by the way, in the world is being able to control the temperature with air conditioning or with heating. And that's a big problem with this virus. This is probably the reason explains why the United States is #1 in death. Had to do with HABAC, has nothing to do with other things. I mean, of course, vaccination and mask use and all that stuff has an impact, but you know, people use masks in Chile and still have a high mortality. But again, it's closed spaces, and it's not going to be about trying to convince the more conservative ones to use masks. Really, I don't think that that's the way to go.
I have two comments on the issue that William and Manijeh and many of you have been just talking about, and it's about this issue of politeness, because there are some things that are just wrong. When I was in high school, I was an orderly at a community hospital, and I had a female friend at the time who was a candy striper. And when the doctor went on rounds, my job was to carry his chair into the room, and her job was to carry his ashtray. So we collectively joked that our responsibility was to take care of the doctor's butts. And one day where it really went over the top and I got furious is there was a young woman in her bed up in stirrups because she had a cobalt implant, a vaginal cobalt implant for her cervical cancer, and the doctor was blowing smoke in this poor woman's face. And I think there are things that are morally wrong. So I often go back to Eldridge Cleaver and the quote he's had that there is no more neutrality in this world. You're either going to be part of the solution or you're going to be part of the problem. And I think that's a good rallying cry for us to think of. And it may mean that we have to make a little more noise.
Thank you.
We're taught to be too polite.
Yeah.
Well, I think John Lewis said it when he said good trouble.
Yeah.
Good trouble. Yeah, you betcha.
In that sense, this community is very well placed for this challenge. This is what is interesting, because it's really about a relational thing as well as a larger macro. So our community as Family Process Institute is probably very well positioned to really think through and to offer some ways of getting through this.
Well, and just one other thought is, I think we can propose that we need to value the truth, that there is truth in this world and there are lies in this world. And just to call a lie and say we value the truth may cut through some of this. I mean, you don't even have to go to scientific evidence. You just go to that's a lie or that's true. And valuing truth has really dropped off, at least in our culture and many political cultures. So that's one thought. The other thing I was thinking early on in your presentation is how people don't trust their governments anymore, either in the United States or Iran or maybe in Chile, that, you know, people took it upon themselves to help doctors and nurses by bringing food or making masks or whatever, thinking that our government really is not doing the job. And that might be one of the big changes of this pandemic that, you know, Tom was talking about, what's going to happen at a systemic level, is the role of politicians hopefully might be muted, and the role of community and true democracy might be increased, because, you know, these are the people who care about you, and these are the people who are going to help you, not necessarily the people who are at the top of the government. And I don't know what that would look like, but it's a thought pretty universally across the COVID responses. Although looking at the China figures that you brought out, they are actually doing pretty well with their autocratic government. I mean, there's some advantages of it, but so it's difficult. I don't know what the people of China would say about their government's policies about COVID specifically. I think that would be a really interesting question.
I am more worried about what China is doing in the world, but that's another story.
Well, that's what, but you know, it's interesting. Their government, even though they obscured the truth initially, once they came out and said this virus is deadly,
oh yeah,
they didn't take any pushback from the population. They just said, you are going to be quarantined. You are going to be in this tent. You are all going to wear masks, period. And in a way, that's kind of what Manijeh is talking about, that, you know, somebody needs to speak up and say, this is true and this is the fact. And in our country, had, you know, our president then done that, which of course he didn't, but even now, if Biden's trying to do that, we don't accept that kind of calling a spade. We all have our own ideas about what a spade is. You know, we don't care about what other people say. It's interesting.
Well, I do say that from outside, clearly the United States, it's so many countries. And so you have, I think, countries that are completely out of whack. And then there are others who in some way follow some of the evidence, and the results are there. You can see it in the numbers by state. It's really quite striking.
And it could be survival of the fittest. This could be Darwin's way of bringing the truth forward again. Well, it looks like we are getting out of time. I want to thank you again, Gonzalo and Manijeh, for, first of all, doing this on a Saturday morning, which is never an easy time, but also giving a really stimulating set of thoughts that I'm going to ponder, and I hope we can continue some of these discussions when we meet in September for those of you who are coming to the in-person conference. So thank you.
Thank you.
Thank you all.